we're recognizing 20 years of Insight in Vancouver's downtown east side, which has affected not only the downtown east side, but the province, the city, the country, the world. And we have a speaker's corner type project happening here, which is people from the neighborhood and many of the members that started Insight. And following the show, please stay tuned for a Q&A, which everybody will be open to, with the founders of Insight and some politicians and some other people. And thank you very much to the Heart of the City Festival for helping produce this. And we'll see you afterwards.
Well, like I was saying, a lot of people don't recognize that, the major proportion of the front of Insight. So it's a 3-story building, but it's not all Insight. The first floor is Insight. That facade in the front is sheets of plywood. But I don't think in rainy, wet Vancouver that we build plywood facades unless we anticipate them to be temporary. That would be my take on the original feelings around Insight. No, we're not building something for 20 years, but here we are 20 years later having this conversation.
A lot of people ODing. There was not a lot of harm reduction supplies either that were distributed at the time, so it was an opportunity for people to get clean gear and have some place to go that was safe, where they could use and feel at ease, basically, for not dying on the street. Okay, so when it first opened, there was a lot of people using dirty supplies on the street, and Insight was a tool that they could use to get harm reduction supplies. And so when it opened, there was a lot of backlash, but it's actually done a lot of good for the community. So a lot of people's views have actually changed over the years from when it opened until now.
In 1999, we didn't think, we were working towards having Insight, but in 1999, at least for me, I didn't actually think we were going to be able to do that. It seemed like a really big leap.
At first, I thought it was going to be like a crack house. And so there wasn't a whole lot of information. So I kind of just ignored it for a couple years. And then I started working there. And I worked there for 18 years.
I think it was pretty important when Insight opened. I remember when I first moved down here, just seeing people in the alleys, with no supplies and whatnot, using puddle water, behind Carnegie, just to shoot up with, probably a used rig as well.
I've been part of Insight since the beginning when Brother Osborne opened it. I've been in the community over 32 years, and I used to live in the Vermont for 28 years. And then I became a volunteer at Insite. I worked in the showroom, and I know the nurses in there. I went in there 1 year because I wanted to try and get out of my addiction with drugs, and I wanted to go to Onsite. But I was pregnant at the time too, but they were thinking about it. And I said, excuse me, about a week later, just before I was going to go in, I ended up having a miscarriage of last baby. But the nurses at Insite were really nice and friendly. And they have a chill room where you can go watch TV and chill. And they let you sleep, and they have a foot soak there too. If you need a foot soak, then we help you with that too, and with clean socks.
For sure, for sure. There's so many people down here, even a lot in marriages, guys that would go use, have dates with women and, getting, diseases being passed and stuff like that. It's at least slowed that down or put some limit to it, where now there's safe supplies. It's safe, it's cleaner. There's less bodily fluids swapped, and that affects the outside community as well, even from guys going home to their marriages, right?
And Insite was very careful when it opened. If you're a community organization running a program, especially one that's controversial and has many aspects of public health, which public health is in the domain of the health authorities and not the community groups, you want to succeed, because if you fail, it could be a long time before you get another opportunity to do something that isn't mainstream. And so Insite was very careful to say, you know, we're going to reduce the spread of bloodborne viruses, because we were really confident you could do that. You just need to provide people with clean works. Boom, we've accomplished that. Basically, with the objectives that Insite opened with, it knocked it out of the park. It was completely successful in all three of those.
I did train to work at Insite in 2009, about 5 years after it opened. And at that time, I entered the space as a skeptic, not fully understanding harm reduction, really locked into a way of understanding addiction as being in an abstinence-based model. But I'd lived in the community at that time and been involved in activism and poverty and housing activism, and I knew a number of people who used the services. And when I trained there and worked there, I knew how important it was to members of the community that it was a space where people were, instead of being kicked out of like libraries or parks or churches, clinics, malls, or whatever, it was a place where people were not only welcomed, but they were sought out to come in when they were in crisis. And I thought that that was a profoundly radical thing, and it really changed me and my understanding from being locked into this abstinence-based perspective to seeing the critical life-saving importance of harm reduction and supervised consumption spaces.
I can repeat it.
Yeah, do you want to tell us about that again?
Okay, I can repeat it, yes. When in 2003 Insite opened, it to me it meant just the way of spending government money to try to use a band-aid on the system, on the issue. But as I'm homeless myself now, it seems like it is definitely a necessary part of it. As I've seen friends and family go down themselves and die based on the health services that were not available. Now I think it's a necessary situation.
I was pretty much in the infancy of my addiction kind of thing, so it didn't mean a huge amount to me, but I did realize that the community I was in was more than just more than just my experience of being in addiction and stuff like that. So they were definitely not in their infancy, and this was something that was absolutely needed for the community. So I kind of understood why it was coming about and stuff like that. I didn't know how relevant it was going to be to me in the future and stuff like that, but I did have a feeling that it would probably play a big part of my life.
This is when I first got down here. I was found at the bus stop with a bra on and a pair of jeans and one boot. And a cop told me, you can't be on Hastings naked. And I'm like, I'm not naked. But they're like, you can't be on Hastings like this. And I'm like, okay, well, where do you want to go? And I said, on site. That's the first thing I can think of. So that's where they took me. And then they let me sleep in the trailer until I woke up, and staff checked on me and put a blanket on me and put a sweater on me that was very sweet.
Okay, working the trailer, like I got to know like all sorts of people. There's an elderly gentleman that came in every day from Surrey. He'd do his one shot and sit there for hours, and like I met a lot of people like Carver. He became like, me and him became really close, and he was actually really, nobody touched him, nobody, nothing, and I was actually soaking his legs to get his socks off and stuff just before he died, so it was kind of, and he'd bring me little presents every day, and And he started opening up about his life and stuff. And, like, there was one kid in there, and his family disowned him. And just talking to him one day, and he went upstairs, got clean, and went back to his family and stuff, and actually wrote me a letter. And so things like that just made it all worth it.
Because of Insite's work as the first injection site in North America, now there's injection sites in every province in the United States and Australia, and other places around the world, and people who've done the work in the injection room there, in the chill room. Congratulations on 20 years of service to the community, and all the work that has meant so much to so many people.
I thought it was kind of weird at first, because back home they don't really have places like that. You can do drugs inside, so that's pretty cool. You don't have to worry about getting jacked or anything like that outside, or someone bugging you or anything like that.
I go there a lot. I get my supplies there. They're nice. They always have fresh supplies, and otherwise I'd probably be using dirty stuff. I wouldn't have fresh stuff. I'd probably get sick if I wouldn't go there.
Here we are 20 years later. As other speakers have mentioned, the overdose crisis is, three times as bad as it ever was when Insite opened, and that was considered a crisis. And that peaked at just over 400 people dying in a year, and we're at well over 1,500. 6 people a day in British Columbia. So I think what is profound is that from the day Insite opened in the fall of 2003, there was not an expansion of that service, supervised injection services, for 13 years.
Unfortunately, yeah, I still use street dope. And like I said, I used Insite a couple times, like during the beginning of my drug career, but then it just got to be too busy, and I guess, patience isn't exactly one of my strong points. So yeah, I'm waiting in a half-hour lineup, or going to use somewhere else. It's not really much thought has to go into that. So
I got Narcan kits and Narcan training through them, and even when I was in the alleys, I remember when fentanyl hit the block pretty heavy. I was saving 5 to 8 people a day myself, just in the alley hanging out. And they also provide Narcan kits, to people in the community for free. I've saved many people in the downtown east side, yes. Even when I haven't had my kits, I performed CPR until ambulances got there, sometimes 25 minutes, and the ambulance brought the person back. So.
Narcan and 5 or 6 people a day, and it just, after a while, it started to get to you, because you get to know the people, and it gets personal.
Twice in one day I overdosed there in 2017, I think. Once in the morning, once at night, and that's when that white dope was around. They had signs up for it and stuff, yeah. First time, so it was scary. Definitely scary. Woke up and looking at myself in the mirror, wondering what the hell's going on. Ended up having to go to the hospital and stuff, but yeah, it's good. I'm happy that that place was there, that's for sure.
Got into housing and used it at home, but you should never lose alone. Like, you should always have somebody around you while you're doing that. Doing like heroin per se, let's say you use Insite for heroin or shots or smoking it, but you should still use it with a friend or something. At least, even if you're smoking it, it still could like knock you out pretty hard.
I think the services at a place like Insite, they do transform people, and the first person that needed to be transformed was me. But that relational care model, this radical compassion that that has the potential. It doesn't always exist there, but when we're well, as staff and as care providers, it is a place of radical compassion, and that's the stuff that transforms, and that transformation may be over a long period of time, but it's to me it's a very proven model. Yeah, I think it was a culture. You know, I think the PHS in its origins and at that time they did a remarkable job of creating a culture of people really giving a shit and of exceeding the funding mandate and going beyond your job description to do what's needed and to care for people. And that was Liz and Mark and the original founding ethic.
Have I used it Insite? Time and time again. Yeah. I mean, not just Insite alone, but on-site. Its sister program. I got off crack cocaine in that one. I kicked heroin for 5 months in it as well. I mean, they're always proactive about addiction recovery and stuff like that. They're not like pushing it on you or anything like that, but they are proactive about it. They make sure you're feeling all right, everything's going good, your health is okay and stuff like that. And where you're at for that kind of thing, right? They don't try and push you towards it, they just ask where you're at for it. And maybe that's enough to like lean you in the direction of actually going into it some more.
On site, and I thought it was a beautiful thing because so many addicts die from overdoses that don't need to die. And I really think highly of Insite and on-site both. Not just that, just on personal levels too with people. Like building relationships and knowing people and going out in the community and helping and giving me a sense of community that we matter and that we care, that you guys care. Because a lot of times people just don't care. Right? It's just another addict. That's not how we feel with you guys. On-site does not make us feel like that.
I was living outside and I would go into Insite to warm up during the winter, go to the chill, watch some TV. Oh yeah, the staff are nice. They're always excited to see me. When I walk through the doors, they're like, Joanna!
Would all say in Vancouver that Insite is a necessary service and overdose prevention services are necessary services. Because of the dehumanization that people have been facing and the stigma people continue to face who are poor, who are homeless, who use drugs, who are sex workers, some politicians in Canada, United States, around the world use this as a political wedge to get their own people angry, to get their own people hateful and fearful. So the fight never ends. The fight for space in the community never ends.
Several visits to be able to drop my shoulders and just be who I am. And Insite was a profound project in terms of saying, come out of the alley, come out from behind a car and just be yourself.
And even here, when we're talking about like decriminalization or legalizing drugs, some people say we need to legalize or decriminalize drugs so people don't feel stigmatized using drugs, so then they'll feel safe to go into treatment so they can stop using drugs. And it's like, no, that's kind of weird. We need to be giving people the drugs that they're using rather than having places where people can inject harmful drugs so we can be ready to revive them or mitigate the harms that come from that. So it's kind of almost an absurd thing that we have to do. That's really important that we do it, but it's kind of a half step in terms of policy. We need to go all the way. And while we're giving people with the drugs that they're seeking and taking away their need to go out there, hustle and grind and do whatever it takes to get those drugs, just give them the drugs, and then why don't we worry about housing people? And making sure everybody has enough food and worrying about people's quality of life.
I hope we are starting to chip away at that edifice that keeps drug users down and not able to just be who they are. You know, I'm not hurting anyone, I'm not doing anything wrong, I'm not a criminal because I need relief. And I strive to have some kind of coping mechanism, which, you know, obviously if alcohol is your drug of choice, you have a million options and a million supervised sites. We just happen to call them bars, and they make a lot of money for the government.
All right. Well, so that was that. I hope you guys enjoyed that. We have some of the celebrity guests in house here, and Russ is here, and Kurt's here, and Ronnie's here. So I thought we'd kind of open it up with Mark and Liz, and maybe asking, you know, what inspired you guys to open up Insite, and like, how much time did it take to from conception to the reality in 2003? You got to unmute yourselves.
Well, I didn't want to go first, but I'll go first. Really, Insight was, to some extent, it's just a small side project, because it's like the ideal of harm reduction, and this concept of harm reduction it's really just like a thing where there were much more important and pressing issues. It was just one of many, but it's one that we felt needed to be attended to, just because people we loved and cared about were dying, and it just seemed like disgusting, basically. And so in terms of your question, how long did it take? It was like, first, we didn't really know what to do, you know? So we had to figure out what could we do with the power we have. And then we had to figure out how to get from A to B, really at a time and place of our choosing, because really the ability for that ideal to exist in time and space at that moment didn't really exist. That's why it took, you know, a decade, 13 years for even an illegal one to exist, which is a heartbreaking and depressing thing. But we just thought, okay, with all the beautiful people you've seen on that video, and I'm sure all the beautiful people in that room, and these celebrity guests, including Libby, like all those people together, you know, tried to move this tiny speck to just make a difference. So we did have a targeted plan, and we thought it's going to take like 3 years. So it did roughly take about 3 years to make it happen. But it was just depressing. But there were many things that were depressing. The crap housing, the fact people had no money, the fact people didn't have healthcare that respected them, the fact there was no space. So it was just part of many little bits that needed to be attended to. But it's funny when Kurt was saying, I remember one point we got some young sort of 16-year-old kid designing us like crack pipes with some of the people probably in this room. And he just turned to us at one point and said, what am I doing? Like, why do we not just give people the things they want? And it was like embarrassing, because we were going to all these levels to, you know, see if you could purify a drug or redo a drug. And it's like, can we just give it to people? So.
Thanks, Mark. Liz, do you have anything to add?
Oh, I'm sure plenty. You know, it was honestly one of the greatest experiences of my life to be involved with the journey to Open Insight. And it was really not our intention. We just ended up in a situation and in a time and a place where the suffering was so profound and obvious and apparent that something had to happen. And I sometimes wonder, you know, you look back on your life and you're like, why was I there then? And what the heck, you know, it wasn't like I had a background in drug use. I really knew nothing. And it was like, we all really learned together. And I think I have many people to thank for the journey that I was personally on, and so many international people that helped us, like folks from Frankfurt and in Switzerland, and other experts from around the world that showed us that there were other models that we invited to come and share with us. But also, I can't not mention Bud, because Bud Osborne came into my office with Mark and I one day, and he was just so mad, and I'll never forget that day. And we were sitting there, and Bud was like, "We have to do something. I'm so mad. I'm so sick of people dying." And we were obviously in the epicenter of the death and suffering too. And it was just like this demand he made to Mark and I and to Kristen, like, you have to do something. And I swear to God, Mark never does anything for anybody like in that way, but except Bud could make him like only Bud could force Mark to like be okay. And then like we were literally, okay, we got to do something. And then we all just sort of mobilized and decided, okay, fine, we're going to do something. And that was what led to the whole Killing Fields campaign. And then, you know, Vandu was sort of forming around that time and working closely with Bud and Anne and others. And really, I mean, it was a huge honor to be part of that history. And we were working really hard in our own little sphere, just trying to hold space in our hotel for folks that were active drug users, which was in and of itself radical at that time. And just even trying to run a housing project, working with the staff and training people to just not judge and to be open and to accept and to be there, and creating that culture of love and acceptance. And I think when I feel so moved by watching people speak about their lives, even now, like what the experience is of being a drug user, it's just awful. And there's nothing, you know, nothing that if I could do anything, it would be just to eradicate all the bias and the judgment and the pain that people are experiencing just on the basis of the fact they use drugs, which is just such an irrelevant thing ultimately in the grand scheme of things. People have faced so much trauma and judgment, and really Insight was like a tiny speck on the landscape of trying to say there could be just one place where there's like however many square feet it is, where when you walk in the door, you're not like judged for the fact that you're a drug user. And I know I've heard so many stories from people who used it in the first years who would come in there like, what the hell? I can come in and use drugs and people are nice to me. And that was like, it was very radical. Like it was a shift in the way people had to think. And it was like amazing to be part of that story and to see that happen. And I'll stop. Otherwise,
Yeah, I mean, obviously, I agree with everything you just said there, but what you were just saying about that, like Russ, Kurt, and Ronnie here all spoke about that when I was sort of conceiving this idea about, and what Ronnie said in the doc about radical compassion, I thought was really, really amazing. And I think that's something that you guys created and that I wanted to show in this piece. Jean, you've been an activist down here since I think the early 70s. Did you see much difference when Insite opened in the neighborhood? Oh, you're muted.
Sorry. There's a time when I wasn't in the downtown east side so much. I was up on Broadway working at End Legislated Poverty. I'd come down to the rallies. But the difference that I notice is between now and say 5 years ago, it's way worse. It's absolutely terrible. I can't remember seeing. The other day I walked on 6 blocks and I counted 26 people who were passed out on the sidewalk. Some were literally lying flat out in the middle of the sidewalk. And it's really bad now. And we desperately need to take another leap. Like Insight was 20 years ago, we need to do that now. I mean, some of what we're experiencing now is a result of 3 decades of not funding social housing and 3 decades of not funding social services, and it's just cumulative. And what Nathan said about politicians using people who use drugs as a political wedge to get their own people angry. We're really, really seeing that now. And I'm terrified that it's going to make everything worse, because what we, of course, need is less poverty, more housing, and a safe supply. And I'm just so angry that Jeremy and Eris were arrested when they're for saving lives. And I'm hoping we can do something to put an end to that.
Yeah.
I think I'm not answering your question, David. I've just
No,
ranted.
you're completely answering my question, Jean. Libby, you were I think quite a force to help Insight be opened. And you're a force in the downtown east side for whatever, 17 years or something like that. Can you maybe talk a bit about how it was helping to open it politically?
Sure. Well, actually, Jean and I have been around the downtown east side for 50 years. We both started in the 70s as community organizers at the Downtown East Side Residents Association. So the 18 years you refer to is when I was a member of parliament representing the area. But David, I just want to say that was a beautiful film. And just to hear people speak about what Insight meant to them and means to them personally, I had tears in my eyes. It's really quite incredible, because I agree with Jean. There's so much that still needs to be done, and things are worse, but Insight was transformative. And I had just been elected as a member of parliament for Vancouver East, which includes the downtown east side, in 1997. And Mark and Liz, I think the first event I went to as the newly elected MP was the Killing Fields with Bud, where he read his poem, 1,000 Crosses, and then I later read it in Parliament. It was the first speech I made, I think, in Parliament. And it was incredible, because back then, David, people thought of people who use drugs as criminals, as people to be demonized and vilified. They were subhuman. And so to change that narrative, and just about every politician just wanted to lock people up, and throw away the key because they were criminals. And so even to shift the debate and say, this is a health issue, this is about people's lives, this is about saving lives, this is about providing good housing and, a safe injection site, was really hard. I mean, now we look back on it and maybe we think, oh, well, that was okay. But it was a huge political battle. And I think what I want to contribute to the discussion is it wasn't just a battle to open Insight. I mean, it was huge bureaucratically. And to me, groups like Bandu, the voices of people who use drugs themselves, was the transformative thing. Like Bud, he convinced the Minister of Health in Ottawa, I took him to meet Alan Rock, and I remember that meeting twice. And he was convincing Alan Rock about why Insight had to be open. So the voices from Bandu were so critical, but Mark and Liz at the PHS, without you guys, without the leadership and the organizing you did as well, it would never have happened. But it wasn't just the battle to open Insight, it was the battle to keep Insight, because then we ended up with a conservative government for 10 years, and all they wanted to do was shut it down. And so it went all the way to the Supreme Court of Canada. And I remember once speaking to a conservative MP, who I shan't name, and he said, we get it. We actually get what Insight does. And then I realized it was totally ideological. And this is what Nathan Allen was referring to. And so they used drugs. They used, quote, drug dealers as a weapon of war against people, right, as a wedge to drive and divide people. And that's always been the way. That's what the war on drugs was about in the United States. I remember when that awful drug czar, what was his name? He kept showing up in Canada and threatening, this, that, and the other to shut down whatever was going on. Luckily, he was never successful. But so the political battle was also enormous. And I always felt like I was sort of like a bridge. I worked very closely with Bandu. Mark and Liz were always on the other end of a phone call. whenever I needed help or advice about what the fuck to do next, kind of thing. But it was a political battle. And what I think is remarkable is that it was grassroots. It came from the community. This was not a national thing that came down to the downtown east side. It was the downtown east side and groups like Mandu. And there were allies, scientists and doctors and and people who did research, but it was the people in the community who fought this all the way to the top and made it happen. I don't think we should ever forget that, because I think it's like an amazing example of the power of what people could do. And I'll just end on this. I remember once going to a Bandu meeting when they were on that church place on East Hastings, up that long flight of stairs, and there was about 100 people jammed in the room. And Anne was madly scribbling the stuff that she used to scribble on the flip charts about what people were saying. And I remember people saying, we'll never get it. It will never happen. It's not, that was about 2000, maybe even a bit earlier. And I remember saying, yeah, we will. We just have to keep together, right? And so this idea that we could do it with all these alliances, it was very powerful. And I think we learned from that today. Vancouver has always led the way. And as Jean says now, the issue of a safe supply and just being where people are at, as some of the people said in the video, this is what's got to lead the way. And we have to keep doing this work because it's not done yet. People are still dying.
Thank you very much, Libby. Kurt, you spoke a bit about this. Do you want to add anything to that?
Right, could be more helpful here. Sorry. Yeah, David, I really enjoyed watching that video. Sorry just for making this comment. And it's obviously I was at Insight when we first opened it and helped opening it up, and it's great to reflect on that. There's so many layers for me talking about this. Of course, I want to celebrate Insight. It was an amazing thing that happened then. I remember how much hope we all had as we started when we first opened it, and thinking where this could lead to. But then, of course, over 20 years, things didn't go as we hoped, and so sometimes I'm kind of reluctant to celebrate Insight now because of all we didn't really collectively follow the course that Insight sort of put us on. That was sort of an increment towards what we're talking about, where Insight was doing everything you possibly can to meet where people are at. Like, you're going all out to the very end of what is possible with what's legal and what's allowed in the regulations, and that doesn't seem to be happening now. And I'm hearing what Libby's saying about the community coming together to make this all possible, and that is very true. But I just have to put in this comment that I hear all the time when I'm talking to others, people from other cities and whatnot, when they're talking about opening up an OPS or getting safe supply, they're saying, well, yeah, you can do that in Vancouver, but that's Vancouver. You had that community there, but it's not that simple. It's like, yes, the community's here, but it required some real thoughtfulness, and it required people willing to take a lot of risks, and people who did take a lot of risks who actually paid for it. Some people who are on this call, and yes, the community is important, but it also takes people like Mark and Liz and people at Vandu, people like Eris and Jeremy who paid the price there too. We have to do everything we possibly can. And anyways, I guess that's the point I'll make there.
Hi, David. I'm going to move a little closer to you, Kurt. Can you prompt me a specific anything to add? Well, plenty, and I appreciate. It's nice to see. I'm looking that way because there are all these amazing faces on the screen: Mark, Liz, Libby, and Jean, and it's really nice to see you all and your participation. And I think it's just for me. I wasn't there. I wasn't there at the founding. I came a few years later.
was deeply impacted by being involved in the work, and just a lot of the things that I'm reflecting on is how critical crisis becomes, and how much, you know, our communities have to wait till these tragic crises occur before anyone is willing to hear what the community needs. And that is certainly heartbreaking. I appreciate bringing the efforts of the Drug User Liberation Front, Dolph, and Jeremy and Eris, and just how much they have flipped, you know, that moral posture. They were transparent and open, and not profiting, and responding to, you know, just so much loss and a critical need in our community, and decision makers and the powers that be respond by their arrest and humiliation and destabilization. It's and we are in the shadow of that, like days ago. And so to hear these origin stories and to remember them, I'm one who believes deeply in remembering how we got here, why we got here, and to fight to remember, but also to not have to relearn. And so we're in this, you know, devastating crisis, and we are worn thin. And then what do we have to do? We have to relearn how to listen to the community wisdom, and we have to have people who are willing to risk. I can't risk like those guys do. I can't afford jail time. I can't, you know, and not that they can, but I mean, it's these actions that create change, the punching up, the time and the effort. We do have to remember what we've learned by your efforts, and by the efforts of the community. And unfortunately, we have to relearn and relearn. But hope, you know, I always sound so down when I talk about these issues, but I'm a remarkably hopeful person, and my hope is because of the people who gather in rooms like this, and the dedication, the people who do the heavy lifting, who lean into suffering, who engage, and know the people who are most at risk in their communities and don't turn away, and those people are the hope moving forward. And I might include myself as one of those. And we are not turning away, right? And that is the hope, the ongoing hope in all of this. So unfortunately, you know, it requires so much crisis and risk and suffering, but I am, despite sounding so depressing when I open my mouth, I am a very hopeful person because of these stories we're sharing and remembering together. Thanks everyone.
I'll try to be brief. I would just sum up like 20 years of being around these issues. When I think back to the beginning, there was so much less so-called evidence and proof, and now we have a preponderance, and we know there's a huge difference now. We know Insight saves lives. We know safe supply can save lives, and we know that housing saves lives, and we're still not actioning those things. And so for me, at this point in my life, it's a civil rights issue. There are issues here that are about people's ability to live and be part of society that aren't being addressed. And we normally couch that in terms of civil rights. And I just think that there's a civil rights issue here. That's the cumulative impact of the last 20 years. And I hope that becomes a much more common issue in the public discourse, that we're talking about people's civil rights and their right to belong and have the basics in our society.
Well, thanks, you three. It's a tough act to follow. But I think we can pretty much wrap it up. I'm a little emotionally disturbed. I really want to thank all of you for showing up. I do. I was hoping Kenneth would. Okay, is there any questions out there? Yeah, you can just put them in the chat on Zoom for anybody to answer.
I could add something if there's time.
Oh yeah, there's plenty of time.
So back in about the early 2000s, I wrote this book about poor bashing, and a lot of it was about the stigma against people who are poor. If I had to do it again, I'd include drug users, but I think it's similar. You know, when I go to a Vandu meeting now, people go around as a check-in and they all say, I'm so glad to be here. I'm so glad to be here. And everybody's so glad to be there because there's no stigma and there's no judgment. And back in the 20s, all the politicians were, you know, even Mike Harcourt was saying, you know, that people on welfare were cheats and varmints. And now the language has changed. The language for a lot of people, or progressive people anyway, is inclusive. And the government funds an ad campaign to get rid of stigma against people who use drugs. But the policies are the same. The policies are still poor bashing policies in that they create the poverty, in that they don't provide enough housing, in that there is no safe supply and everybody's dying. So we have to make this leap from, in the old days, it was rhetoric was all bad and that was justifying the horrible actions. Now the rhetoric is getting better, but the actions are still bad. So if there's some sort of way that we can make that link, I don't know what it is, but I just thought I'd throw that out there.
Thanks, Jean. I did have, going back into the past a bit, I did want to ask Mark and Liz how you started the PHS, how you started the work you did down here.
Well, I was actually hired by Jim Green at DERA to run a hotel that was the original Portland hotel that's now the Pennsylvania. And at that time, I'd been working as a nurse in an emergency department and was quite frustrated about how many people kept coming through the ER and needed what I would say were not like medication or like medical solutions. What they needed were like, they were in life crises, and I couldn't reconcile the number of people that kept coming through and or this sort of revolving door scenario that we really didn't have the appropriate solutions for, and left frustrated and, you know, ended up just leaving out of a disillusionment around my career and my life, knowing I wanted to be in a situation where I could help people in the context of their lives. And then sort of walked in and had randomly heard about this guy, Jim Green, in this organization, walked in and met him and said, like, I don't know what I'm doing. I just want to work in this community. I've heard blah, blah, blah. And he's like, oh, we've got this hotel and we need someone. They had a little grant to provide support to folks that were mentally ill and in the context of an SRO. And so I got hired to run what was meant to be at that time 10 beds for folks with mental illness. And, you know, very quickly after that, I was running the building. And, you know, in the first sort of 3 months of just like opening the doors and saying, we just want to be relevant to the needs of the people in the community, we were inundated with people that were pretty complicated, had multiple reasons why they'd been kicked out or barred from other places, that just needed support and housing. And so it was sort of thrust on me this idea that we need to be welcoming, because clearly people are unwelcome everywhere else. And the goal here is not to bring people in to move them on, but really just to provide a home. And so quite quickly, a high percentage of the people that we were housing had issues with drugs and multiple things that they were using, and, you know, everything really from glue to cocaine to crystal meth to heroin to whatever. And I knew absolutely pretty much nothing about drugs, and really sort of thought, okay, well, we should get people clean needles because they're using dirty ones. And oh, we should bring things to the building to help people because they're not welcome in other services. And so it was this very organic and pretty, I think, common sense response to the needs of the people that we were serving. However, I would just say that at that time in the early 90s, the narrative in the community about the people that we were housing was not one that was particularly compassionate. And the folks that we were housing were really seen as almost like the cause of the problems in the community and the pariahs themselves. And so to try and rebut that narrative required some fairly intentional education and conversations and trying to talk about the stories and the lives of the people that we were working with in housing in a way that was not, you know, diminishing or disrespectful. I mean, I certainly didn't feel that way because the people that we were housing were really the people that taught me everything and that I grew to love and care about deeply. But it was heartbreaking to watch how they were being treated in the community by both other organizations and service providers. And as Bud wrote in his beautiful poem, A Poem of Remembrance to Linda Gaines, those who, you know, make compassion their careers, you know, like people who were paid to be compassionate were not compassionate. They were intolerant, they were cruel. And there was like this unkindness systematically. And so for us, it was like really odd to be sitting in the middle of this neighborhood with all this trauma and all these people. It was like being in a refugee camp and there was no services. Like we were just trying to bring water to people who were like dehydrated. There was nothing, like just the basics, like getting wound care done, or people were starving. They were like being raped and abused and violated, and they were living in our building. And it was like, and we were then blamed because we were seen as the bad parents because we were housing people who were, you know, eventually it became like, why aren't you doing more? Or it was like at that time, the kind of mark of being a good service provider in housing was that the people lived in your housing were some kind of a reflection of your ability to manage housing, which was a weird phenomenon. And so anyway, that's really our origin. And then slowly we recognized that I think as a group of people, really not very many of us really like working night and day for like 10 years, just trying to provide a space that like what people needed really was just respect and space. And through that conversation that took place over like the 10 years really in the 90s was about rethinking the narratives and like pushing back on all of the rules and all of the barriers that people felt and had to meet, whether it was just basic healthcare, like going into a clinic and getting kicked out because they were a drug user, not being able to get banking, not being able to get their teeth fixed, not being, you know, like, you know, I understand and I find it horrific to listen to what's going on now. And it's so heartbreaking. I was there in September for the 20th anniversary street party. And I find it really, really painful whenever I come back, frankly, from New York to the downtown east side to see what's happening. But I would say that I am in the States now, and the conversation here is pretty much where it was 20 years ago in Vancouver. So if you ever feel super defeated, don't be too defeated, because like things here are very hard, like to try and turn this narrative around. Like I'm literally at the beginning of my career again, like just all the same conversations about why we should have compassion and respect and love and treat people with dignity, and why that's not enabling, and why we're not causing people to die or bring them harm by ideas like overdose prevention centers, or, you know, like, and Insight stands still, I think, as a testimony to that work and has had a very strong ripple effect in many places, not just in Canada, but around the world, and stands as a testimony to those efforts. And as awful and beleaguered as I'm sure you feel in the epicenter of what's going on there now, and all of the things that you're fighting and struggling to try and still achieve, which thank God you are and continue, because you will continue to be a beacon of hope, hopefully, for the rest of us. But, you know, the US is really behind, and Insight continues to be this thing that people here can only dream of aspiring towards. So anyway. Sorry, I went off topic, but
no, that's great, Liz. Yeah, 1 second. I think Kurt has something to say.
Thanks, David. Thank you, Liz and Jean. I think I just want to touch on one aspect that Liz was talking about there, and especially that applied back then. That's sometimes I think is missing now is when we were working on opening up Insight, and when we had Insight open, I think we collectively had this really fundamental understanding of respecting people who use drugs to be people who use drugs. And I'm not saying like we absolutely need to improve our treatment system here in BC for people who are ready to change and try and not use drugs. But right now, maybe going to what Jean was talking about is how come we have all this campaign and communication about anti-stigma, yet things don't seem to be changing. And I'm noticing like when we're trying to sell decriminalization, it's to destigmatize people who use drugs so that they can then feel comfortable to go and get treatment. So, or when we're talking about harm reduction, quite often it's to keep these people alive until we can get them to get into treatment. There's this lack of understanding, like a lot of people who use drugs want to be people who use drugs. And our policy right now in drug use and whatnot is all geared at turning people who use drugs into people who don't use drugs. We do not respect the essence of people who use drugs to be people who use drugs. And that's why so many people continue to die. 75% of the people who've died from overdose since 2016 did not have a diagnosis of opioid use disorder. And many others who did have opioid dependence are quite comfortable with that. I've had many people tell me that if they didn't have opioid dependence, just give them a couple of weeks and they would have it right away because they need to use those drugs for whatever reasons they have. We need to develop policy that respects people who use drugs to be just that. And right now, even people who seem well-meaning, who are talking the talk and whatnot, still aren't quite getting, even though they have a caring face on them, their intention is still to change the essence of the people that we're trying to take care of. And then we're going to what Russ is talking about, is this is a human rights issue underneath all of this.
David, could I jump in as well?
Please do.
Yeah, well, just picking up on where our discussion is going about where things are at now, and Jean's point about how the rhetoric has changed, but the actions haven't, and Kurt's point that, there still is actually stigma. And I mean, I've just been sort of thinking about that, like, why is that? Well, there's many reasons, but I actually think one of the reasons is that, sometimes people who are in elected office, to be quite blunt about it, they're actually afraid. They're actually afraid to do the right thing. They may know it. They may see all the evidence, but politically they're afraid because of what they see as, a backlash, or they'll go too far. And so I think in some ways, like, to me, the most important thing is to open up the space and to make it clear that the solutions are actually very evident. The solutions come from the people who actually are living what's going on, right? And if only we could put aside, all of the lobbyists and all of the, the this and the that, if only we listened more and genuinely to people who are going through their own experience, we would know what to do. It's just so evident. And that, I think that was always the philosophy of the PHS, from day one. It was like, yeah, you guys knew what to do, but you listened to people and you heard what people were saying they needed and you acted on it. And so somehow we have to get that message through, right? That one, you do have to be brave, because these are big shifts in political debate, in political culture, in these deeply, deeply ingrained attitudes that we have about people. And it goes far beyond drug use. It is about poverty. It is about seeing people as other, and somehow they're not good enough, and that the government has to administer in some way. And it's getting beyond that. So it is a lifelong work. And but I truly, truly believe, I think the biggest lesson I ever learned was that if you work with and listen to the people who are experiencing what they're experiencing, the path to go forward will be very evident. And you just have to be true and to follow that. and things will get better because people do know what the resolution is. They know what needs to happen.
It's actually
But
interesting.
how do you get other politicians to feel that way, Libby?
Well, Jean, I mean, you and I have both been in elected office, and as you know, it's like not a magic bullet. It's like literally slogging it out at many levels, one by one, sometimes, convincing person after person until they actually get it. And I do think that the idea that you work at many levels, like I believe in radical action, right? There are people who can take that on. And it's almost like a shock treatment. There are other people who do the quiet inside lobbying. That's really important too. There are people who are elected who are allies, and they do their part. So to me, it's when we can engage at all of these multiple levels and they come together that the change begins to take place, right? And yeah, it's slogging work. But remember, people never believed that Insight was going to happen. Like they were, even in the drug using community, people didn't think it. I remember talking to Bud and the folks at Bandu. Like people had to believe it themselves first that that could happen, that it was politically possible. And so as someone was saying, we do have to go back to that history and learn from it, because otherwise we will just be doing everything over and over again and just mucking around. But I feel I'm an optimist too. I really am. Like I believe that change is possible when we can work at all of those different levels and make them work together.
Just on a tactical error, and I don't really count Libby and Jean as politicians, but I slightly so they were Libby especially played a huge role, because she's more respectable looking than me and more articulate. But in translating these words, but the issue, and I can really speak to the issue in New York, because basically we came to New York and just rolled out the same strategy, which was don't deal with politicians. So the only politicians we tried to deal with is, the president. So we hired one of the people who's now Biden's spokespeople, so that there was someone close to him that could explain these things. And we did the same that we did to Philip Ohm. We just hired her to come and present a presentation, and the presentation was for her. Just like when we were doing the tours in Vancouver, the community input, the only audience as far as we were concerned was Philip, to get Philip on side. You need one politician that's sadly going to kill themselves, because you will lose your career as a politician with status if you've either got to do it when you're going out the door or where you're coming in the door. So in New York, the way it happened is de Blasio was going out the door, and his staff and a whole load of people came, and loads of the people that are sitting there secretly met with those people in a way there was no media. They, I think around 100 people came to Vancouver, the prosecutors, the New York Police Department, and they came to the conclusion by meeting, some of the beautiful people you've seen on the video and some of the beautiful people that you see there, and just having an honest conversation where they didn't feel like politicians. They could ask dumb questions and come to a conclusion. It's a bit like Alan Rock when we demonstrated against, we did like a micro demonstration against them, and he sent someone the next day, and the guy said, he went to the Washington, and some guy had a chicken stuffed in a microwave and was trying to offer him to make roast chicken, and the guy said, I feel ashamed. We'll get you some money tomorrow. Now, it wasn't really that useful getting some money the next day. It's $3 million, but it was just that you don't really, you have to undermine the politicians. You go around them, and then you just need one that's going to sacrifice themselves to, like Philip really did. Like, basically, that's what he did. And so it's doable as long as you have the people on the ground. So in New York, we ran lots of stories in all the media, and you wouldn't really notice that they were run by anyone, but they were, Mike Bailey talking about his life in jail in Rikers, for stealing shampoo to get drugs. There were endless stories like that. Trump supporters whose sons had died, and they were all just random stories that were placed, across the New York media. So it saturated the media, and basically the media basically were on side before the politicians even knew it, So it's kind of like politicians like Libby and Jean are a different kind of person. They're like a community person. They're like the people in the room and the people you saw in the video. They're beautiful souls that want to see change. But the real ones that are in control, all due respect to Libby, the mayors and the governors. I mean, the example in BC is basically what Gordon Campbell said to us. He said, I'm on side for this. I'm going to mention it once. You can put my name on the thing. I will get the money. Because literally 24 hours before Insight opened, there was no money. And if Coastal Health said, we're not going to open it because there's no money. But Gordon Campbell said, I'll send the money. It'll be this, whatever it is. I'll mention it once. Don't ever thank me. Don't ever put me in any media. I'll just say I'm on side. And then you guys, blame Libby Davies and the PHS and Vancouver. I don't want anything to do with it, but it's the right thing to do. But so he had to do it discreetly, but if you do it as a politician with power, if you're a mayor or a governor, you are going to lose your job. Truth be
And
told.
I would add to that politicians typically don't lead, they follow. And if they feel there's a groundswell, and if they feel something has hit a strategic mass of public interest and will, then they have no choice. So I feel that the work on the ground is the most important work. The change has to happen in the hearts and minds of people in the community, and we have to talk to our brothers and sisters and family members and friends, and we have to communicate and take every opportunity. I used to do so many tours and so many conversations, and sometimes there'd be like 5 people in the room, and I say, it doesn't matter who the 5 people are, every opportunity matters as much as the next. It doesn't matter if I'm speaking to the Board of Trade or 6 people in my living room. It's just communicating and taking every opportunity possible and spreading what you care most about and what you're passionate about. And you have, all of you in that room and on this call, a voice and power. And I think we feel so disempowered so often, and there's plenty of reasons why we do in this current world feel disempowered and feel hopeless, and there's plenty to feel hopeless about. Believe me, I've gone through deep depressions and deep feelings of hopelessness, but somehow, like Libby, I also remain hopeful, somehow weirdly, that there is a purpose why we continue to cling to this idea that there is a more civilized way of being in the world with each other. And if we don't talk about it and use every opportunity we have to promote that, politicians won't ever come on side. They have to feel that people care. That's the power. The power is actually with us. And they did realize that in Vancouver when the MPA got wiped out. That wasn't because Philip did it. It was because the people changed their minds, and the politicians realized we don't have that party was fucked, frankly, because they hadn't come out in front of this issue when the rest of the city was there, and they were behind the 8 ball, and so they lost every seat after being in power for 14 years. That was a pretty significant thing, and that was because of the people in Vancouver, I think, frankly.
Yeah, I have something to say about that, I think. Kurt and I, along with Jordan Westfall, we created the term in my living room, I think, what was that, 2017? Yeah, 2017, we came up with safe supply. And we had a document typed up that was sent to Health Canada, which was then disseminated across the country to healthcare practitioners. And never did I think that the hardest people to sell it to would be the people of the downtown east side, which it still is. And so we were largely responsible for the Dilly program and things like that. We wanted diacetylmorphine. We were speaking with Diamo at the time in Switzerland and things like that. And but the people I was speaking with in this neighborhood were very against it, and still are to this day, because there's government involvement. And same with the vending machine, that we were working with, and that's basically just a safe to store your drugs. But because there was a handprint involved, people didn't want to have anything to do with that. The government, but so never did I think that this community would be who we have to sell this to, because I thought that free drugs disseminated through pharmacies that got you as high as you wanted to off street drugs would be a cool thing. But no. And so as much as you talk about, or as you guys talk about, the politicians, we had already sold the politicians on this, the federal government, not the provincial, but it was the neighborhood that was pushing back against it more than anything else. And I found that very disturbing. I understand why. But I think we need to look at it kind of both ways as well, on how do we have people accept these programs, and what do they do if they do? And if you don't have to hustle all day, what do you do? And life skills, Dirk was a great example of that. If there's a whole bunch of those, it'd be a start. But yeah, I just had to say that.
Well, just on that community education thing, I mean, that it's really always the same. Like, we didn't know what to do, and deciding what to do was complicated. Like, Bud's yelling at us, you got to do something, but God knows what to do. And at that time, I remember standing outside the Carnegie, and a well-known drug user I heard her going on about, oh, you've ever heard these things? They give Candice to babies. And I thought, shit, we're never going to get anywhere if there isn't an even information playing field. We all need to understand something. And that really was out of harm's way. So that was designed as a ground clearing targeted at the people who lived in the community to do the respect of, let's have some information about this thing, rather than the stories our Nan told us, or, like, you go blind if you read in the dark, like, mother doesn't know best. It was to share that information. So that was a critical incident, and we had to organize that in about 3 weeks. And, again, a politician gave us 70 grand to do it, but it was really very important to show the respect of providing the information. Like, if you're a member of parliament, you get information. You don't just have to pluck ideas out of your head. You get people that can tell you, oh, we've done this, and you hear it. So I think that's always very important, but it's always also then important that, the answer to these things is bums on seats. The thing that worried me about Insight was, would anyone want to use it? Do they really want Nurse Cratchit in a stainless steel room? And, they're going to listen to us. So part of that was we also did a campaign on the ground that actually cost a lot of money. We spent about 40 grand advertising it. You wouldn't have seen the campaign, but it was just targeted at people to say, hey, this is your site. It's for you. So perhaps you should use it, So I think there's kind of really all these things to me seem to come from the bottom where I am. And most of us are here, even poor Libby as a politician. We're all at the bottom. We're actually not in control. But if we collectively, that includes the users and whoever it is, decide something, it will happen. And that's the end of it. Politicians are spineless. As Libby and Jennifer, Jennifer, who ran as the mayor, was, we met with her many times, and we even brought in people to try and convert her. She hated injection sites, but then she was campaigning on them 2 minutes later when she thought she'd lose. So, there are principled politicians like Libby and Jean who are just people, that trying to create a more beautiful world. But they sadly are not in control yet. And so the ones that are in control, all they care about is being elected, as Libby said. So if you can do that, they will always kowtow and always do what you want to do. In New York, that's what actually happened. It just became that you couldn't really, of course there are people who are against it, but you couldn't be against it because the public, it crept up and bit them in the ass. So they didn't realize it was going to bite them in the ass when the most right-wing television station's doing like, and some of you are involved in that, like a 3-week thing that was the highest viewed news story in New York for that year about how great these things were, then you've won. And politicians see that and they think, oh shit, so are they going to speak on the, News 7 that it's a bad thing? They're not. They're going to just go along with it and keep their head down. The reverse of, how Libby explained, they don't want to take risks. So they don't want to take risk if the public want to see something done. They're going to do it, even if they don't agree with it.
But, David, like even with Insight at the beginning, there was massive opposition in the community. I remember being at one meeting at the Strathcona Community Centre where I was standing in the middle of an aisleway, and on one side were the Bandu people and on the other side were other people, and they were literally screaming at each other about not wanting a safe injection site. And so, like, remember the Chinatown Merchants Association, and there were all kinds of groups who were opposed to Insight or any kind of harm reduction. And so, like, yeah, as Mark says, it was a process within the community too. Like, these things just don't happen magically. We had to convince people in the community that this was the right thing to do. But again, to me, it was the power of the voices of people who use drugs, who kind of were able to get above all of the craziness to say, look, this is who we are. We're humans. This is what our experience is. This is what we need. And finally, that begins to get through. And the only other point I'd like to make is that when you're dealing with politicians, you don't only have to deal with people who are in power. You can deal with people who are in opposition, because they can. I was always in opposition. I was never in the government, so to speak, in Ottawa. But even as an opposition member, I could lobby. I could go speak to ministers. I could, raise shit in my own way, right? And even within my own party, who was opposed at first to things like this, certainly provincially, I remember that very well. Various provincial NDP ministers who were terribly opposed to safe injection sites. And so even within my own political universe, it was a battle. So don't ever underestimate, people who even are not in power, but who can become your champion. I think that's what Mark's saying. You have to find the champion, right? Who's going to be your inside person who will help convince other people. But none of these things are like, by a few days or a few weeks. Like, the battle for Insight took a few years. And but it was transformative, and we've learned from that. And so I remain convinced that we can keep it going. And and we just have to, you can't give up. That's all. You just can't give up.
Thanks, Libby. I think we can there's some comments, but I think we should wrap it up pretty soon. Okay. No, you can.
Hi, this is Teresa. I'm going to read a couple of the comments here from Cassandra. Like Libby and Liz have been saying, it's a matter of convincing people one at a time if necessary. That applies to the people of the downtown east side no less than anywhere else. It's a matter of breaking down biases. We just have to keep slogging away. So thanks, Cassandra. And Rebecca, that speaks to the deep distrust of not only the politicians, but also the healthcare system, the massive power of marginalization. Starting at Insight so young was both a gift and a curse. My standard of healthcare is vastly different than most. Oh, there's, from Cassandra. I just want to thank every one of you for the work you do. It gives me hope that I am not alone in wanting more and better for those who are suffering and dying out here every day. Gives me hope that I'm not the only one who sees that those are people out there. 2 hearts. And was there one more, Kimmett? Definitely feels, from Cindy, definitely feels like we are battling that same battle 20 years ago in Alberta. From Nadia, regarding the political advocacy, there is a risk when political parties change in government, the new ones can use the issue of drugs as a topic to divide society, especially with groups of the population that have no information. Here I am talking from the immigrant community, where the use of drugs has a huge stigma. Our communities haven't had the chance to reflect and see the use of drugs in the way we are seeing it here. I believe that we need to build community power from the information and understanding of the use of drug and destigmatize the use of drugs. And thank you, everyone. That's not me, but thank you, Teresa. Thank you, everyone. So much gratitude for your sustained caring and love. Wow, great comments.
Thanks for reading. Yeah, so Mark, Libby, Jean, Liz, thank you so much for everything that you did and have done and continue to do. And it's so nice to see your faces. Yeah. Thanks to
Lovely to be
celebrity
here.
guests.
Nice to see you guys, and thanks for all you do.
Yeah,
It's
thanks.
inspiring.
Thanks so much, David. It was a great film.
Thank you. Appreciate
Nice
it.
to see everybody.
Okay.
You too. What are you
Take care.
knitting away over there, Jean?
Yeah.
She keeps busy.
I bet you're knitting.
She
All right. Mic drop out.